Thousands of stem cell therapy procedures are conducted globally every day. However, when you ask the provider of stem cell therapy, they generally tell people that when you administer stem cells, they go to the site of injury and they transform into the cells that have been lost. There's very low likelihood that happens. We have to understand some of the very basic principles of regenerative medicine. I would like to start with three different categories of stem cells. There are hematopoietic stem cells that make your blood cells. Then there are tissue specific cells which reside in each specific tissue and they give rise to that tissue cells. For example, liver. Liver has a reservoir of cells that know they can sense when liver has been damaged, they will make more copies of themselves and they will restore the liver function. But they need help from a different type of cells. Those cells basically are referred to as mesenchymal stem cells. However, there is a controversy over that name. We won't get into that. However, these cells, which are referred to as mesenchymal stem cells, they basically manage the overall regeneration of the damaged tissue. So how do they do that? They have a sensory function. When they are introduced in a system, the first thing these cells do is they go in and sense where they are, their environment, and also they look at the chemistry of the area. So in cases where there is huge amount of inflammation, unnecessary inflammation, they will tone the immune system down. So that is why when these cells are administered even allogenically, meaning that they're taken from one person and given to a different person, they won't cause immune rejection. They generate a curtain of molecules that makes them invisible to the immune system. Not only that, but they'll also calm down the immune system. So that is one thing. In a contrary situation, when there is very little inflammation and inflammation is required, they will go and activate the immune system. It's published. Okay. So sensory function is very important to the functioning of these mesenchymal stem cells. Second strategy they adopt is organelle donation. So when a cell is sick, it is not doing its job properly, they can donate their organelles. It is known, again published, that mesenchymal stem cells can donate their, for example, mitochondria to cells that need more energy. Okay, so these are just the two things that they do to repair tissue. Additionally, these cells can also result in secrete chemicals that can result in formation of new blood vessels, which is called angiogenesis. So we know that all our organs rely on blood supply to do their job. That's what contains oxygen and food for cells to live on. So where there is a decrease in the blood flow in a specific organ, these cells will help form new blood vessels to restore that organ function. Additionally, one thing that is overlooked generally by most people is these cells produce a very, very potent antibiotic. It is also referred to as LL37 or defensins. The normal name, people refer to them as defensins. So, and there's abundance of defensins in human secretions. So that is why you have seen that animals, they lick their wound. So they're basically applying these antibiotics to their wounds. I know there's lysosome also, but these antibiotic molecules play a very significant role. Not only that, these cells then signal the immune system, macrophages, to come and remove the carcass of the dead microbe, whatever pathogen there was. So these cells, mesenchymal stem cells, they play a very important role in overall management of our repair and regeneration. However, there is a problem. Where do you get them from? There are two different ways. Either you can get them out of the patient, you can get them out of the bone marrow, or you can use fat. Fat has abundant supply of these mesenchymal stem cells. So these cells can be isolated from fat or bone marrow. if we are going to practice autologous stem cell therapy, meaning you take the cells from the patient and you put it back in the very same patient. So, but there is another problem with this solution. As we grow old, our cells are getting older. For example, a cell from a newborn, uh, for example, if I take bone marrow from a newborn, every 10,000 cells will have one mesenchymal stem cells. That sounds a little low, but it is fairly high when you compare it with an 80-year-old. 1 out of 2 million cells is a mesenchymal stem cells. So you see there's several orders of decrease in the number of these cells. So you can't always use cells from the patient and put them back into the patient for regeneration. You have to find other solutions to this problem. Not only that there's a decrease in the number of stem cells in older patients, they take much longer to divide. I'll give you an example. A newborn mesenchymal stem cell takes about 24 hours to make a copy of itself. And an elderly patient, it will take 2 days, 48 hours versus 24 hours. So people will say, so what's the big deal? It's just an extra day. So if you take a cell from a newborn, it will make 1 billion copies of itself after 30 days, 1 month. If you take the same type of cell from an elderly patient, it will make only 4,000 copies of itself. 1 billion, 4,000. See the contrast? So you can't always use cells from the patient and put them back and expect robust therapeutic effect. In those cases, people are using cells which come from mesenchymal stem cells, which come from umbilical cords of newborn. Again, these cells are non-immunogenic, meaning that they are not going to cause an immune reaction. They're safe. Thousands of studies have been published on that. So we can take the cells from umbilical cord in cases where patients' own cells cannot be used, and they have a very, very potent therapeutic effect because you can make many copies of themselves in the lab, and rather than administering a few thousand mesenchymal stem cells, you can administer millions of these mesenchymal stem cells, which is important in many diseases. For example, autism, for example, the cardiovascular diseases, liver diseases. You need much higher number of cells to overcome these diseases. We will talk about more diseases in a different video.